The Shipley and McAfee assessment of stuttering helps the clinician evaluate the severity of the client's stuttering by keeping track of the frequency of disfluencies, the types of disfluencies, the associated motor behaviors, the physiological factors associated with stuttering, and the client's attitudes and feelings about the disfluencies. An assessment should include the history of the client, an assessment of stuttering and cluttering, an oral-facial examination, a speech and language assessment, a hearing assessment, a determination of the diagnosis, and a provision of the information. While learning about the Shipley and McAfee assessment of stuttering, there are some basic concepts to keep in mind. The assessment of stuttering involves three procedures: screening, speech sampling, and stimulability. Speech sampling is the most important procedure for any stuttering evaluation. It should be gathered in more than one session and in more than one setting in order to obtain the most representative sample possible. Stimulability refers to the ability to produce fluent speech. Clinicians usually elicit fluent speech by using imitation and instruction. Stimulation usually begins at the word level and then increases in incremental steps. After the initial portion of the chapter explains the basic concepts associated with stuttering, the second portion of the chapter provides the clinician with forms that he or she can use in an evaluation with a client. Analyzing the disfluency indexes refers to the percentage of disfluent speech present in a speech sample. It should be assessed in multiple environments and across more than one session. This process corresponds to Forms 10.1, 10.2, and 10.3 in the chapter. Form 10.1, the Fluency Charting Grid. The Fluency Charting Grid helps the clinician keep track of the client's disfluent productions. While the client talks, the clinician uses a series of abbreviations on the chart to note whether the words are fluent or disfluent. A dot represents a fluent production, and abbreviations represent different stuttering behaviors. Form 10.2, Frequency Count for Disfluencies. This form lists the various stuttering behaviors the client may exhibit. The clinician tallies each disfluency with a check mark. After using this form, the clinician can determine the types and percentages of each stutter exhibited. Form 10.3, Calculating the Disfluency Index. The clinician transfers the findings from the fluency charting grid to the appropriate blanks in this form. This allows the clinician to calculate the total disfluency index and/or the disfluency index for a specific stuttering behavior. Sam is 7 years old and in the second grade. She lives at home with her mother, father, and two younger sisters. She was referred by her second grade teacher due to worsening academic performance. Sam is aware of her stutter, often gets frustrated, and in turn will avoid speaking in large groups. None of Sam's immediate family has a history of stuttering, but her mother's brother received speech therapy for a fluency disorder as a child. Her stutter became apparent at age 5, but there is nothing atypical about her birth or language development. In the following video clip, the clinician will assess Sam by having her read the rainbow passage. The clinician will then keep track of the disfluencies by using Form 10.1, the fluency charting grid. After this, the clinician will then use Form 10.3, calculating the disfluency index. Although she will not use this in the video, the clinician can also use Form 10.2, the frequency count for disfluencies, in order to keep a tally of the number of disfluencies.
I need you to read this to me aloud like you would at school. You may begin whenever you're ready.
The rainbow passage. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch. with its path high above and its two ends apparently beyond the horizon. There is, according to legend, a boiling pot of gold at one end. People look, but no one ever finds it. When a man looks for something beyond his reach, his friends say he is looking for the pot of gold at the end of the rainbow.
Form 10-4, Assessment of Associated Motor Behaviors. This form helps the clinician identify extraneous body movements that the client might make due to stuttering. The checklist is very detailed and categorizes the most common behaviors in different areas of the body. Form 10-5, Assessment of Physiological Factors Associated with Stuttering. This form helps the clinician identify the physiological factors that may occur at the same time as the stuttering behavior. It includes respiratory factors, phonatory factors, articulatory factors, prosodic factors, and the client's rate when fluent. Each physiological factor has behaviors associated with it. For example, behaviors associated with respiratory factors of stuttering include normal respiration at rest, normal respiration during speech, shallow breathing, audible inhalation, etc. The clinician should check all the behaviors the client exhibits and can use the right side of the form to make additional comments. Form 10-6, the modified S scale. Stuttering can cause great frustration, anguish, and pain, which in turn can influence the client's attitude. The modified S scale uses 24 true-false questions to help the clinician gather information about the client's social life. It should be used in the beginning of an assessment so that the clinician can make appropriate decisions about the treatment plan. The modified S scale was designed so that it could be re-administered to the client as time goes on. Re-administration of this portion of the test can help the clinician learn about the client's progress. In the following video clip, the clinician asks Sam the questions that appear on the modified S scale so that she can learn what Sam thinks about her stutter and how she feels about her ability to communicate.
I'm going to read you a statement out loud, and you're going to tell me if it happens to you. 1. I usually feel that I am making a favorable impression when I talk.
No.
2. I find it easy to talk with almost anyone.
No.
Number 3. I find it very easy to look at my audience while talking in a group.
No.
Number 4. A person who is my teacher is hard to talk to.
Yes.
5. Even the idea of giving a talk in public makes me afraid.
Yes.
Number 6. Some words are harder than others for me to say. Number 7. I forget all about myself shortly after I begin to give a speech.
No.
Number 8. I am a good mixer.
What is that?
You can talk with other people in a group more easily.
No.
Number 9. People sometimes seem uncomfortable when I am talking to them.
Yes.
Number 10. I dislike introducing one person to another.
Yes.
11. I often ask questions in group discussions.
No.
12. I find it easy to keep control of my voice when speaking.
No.
Number 13. I do not mind speaking before a group.
No.
14. I do not talk well enough to do the kind of work I'd really like to do.
Yes.
15. My speaking voice is rather pleasant and easy to listen to.
No.
16. I am sometimes embarrassed by the way I talk.
Yeah.
17. I face most speaking situations with complete confidence.
No.
18. There are few people I can talk with easily.
Yes.
19. I talk better than I write.
No.
Form 10-8, the parental speech chart. The parental speech chart is filled out by the caregiver. It allows the clinician to learn how the child performs in different environments outside of therapy. It also helps the clinician learn how others react to the child's stutter.